You're watching Parker Success Academy Clinical Rounds with Dr. William E. Morgan.
Hello, I'm Dr. William E. Morgan, President of Parker University, and this is Clinical Rounds, where we discuss topics of clinical relevance. Today I have a very special guest, Dr. Kathryn Hartlieb. Dr. Hartlieb, thank you for joining us today.
Thank you for having me, Dr. Morgan.
So can you tell us a little bit about yourself and your areas of interest?
Well, certainly. I think right now I'm really excited to be a professor and the program director for the Masters of Science in Functional Nutrition here at Parker University. And I have a really deep passion for understanding communication around health behavior change and helping to apply that in youth and families that are looking for healthy weight, whether it's prevention of elevated weight or ways to decrease weight for their long-term wellness.
And one of the tools you use for that is something called motivational interviewing. Can you give us a little bit of a background on that? It's a very popular topic right now in healthcare, and a lot of people may not understand what motivational interviewing is and what it is not.
Well, sure. So motivational interviewing is a communication approach that allows the provider to be a guide, to work with somebody who's interested in making some behavior changes and have them dive into what's motivating them, their intrinsic motivation, so that they can promote their own behavior change in a way that is empathic and collaborative.
Empathic and collaborative. So it's basically we're going away from the strong doctor or practitioner model of you've got to lose weight to asking them, what are your goals? Why would you want to make a change in your life? So what are some examples of some verbiage we would use to draw people into behavior change? Or is it something that, am I even asking the wrong question? Do people have to be ready to make those commitments before we even use motivational interviewing?
Yeah, that's a really great question. And I think it spends a lot of time inviting the provider to shift their mindset and how they're approaching these conversations. So think of yourself, again, like I said, as a guide, as somebody who is inviting somebody to think long-term about where they would like to be and how their values, their hopes, and their dreams might fit in with whatever you might be talking to them about. So motivational interviewing has been used across a really wide range of health behaviors. And something that I find of particular interest is that motivational interviewing came from really good clinical practice. So Dr. Miller was in Norway and he was working with individuals in the field of addiction. And some of his colleagues, because he was a psychology professor, said, something great is happening in this room. What is it that's happening? What's going so well? And so it was him diving into the types of things he was doing that allowed motivational interviewing to be born. So things like that might sound like someone coming in and saying, oh yeah, I know, I need to work on my weight. And before a provider jumps into, yes, let's plan, let's do something, taking a step back and saying, well, tell me a little bit more about why that is important to you. How does that fit with your goals? A little shift in the why versus jumping into how.
Wow. So when I was in practice for 33 years, people would frequently come in and you're taking the history and they go, okay, I know I'm overweight and blah, 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 blah. And they want to get that on the table right away and put it off to the side. So we're going to talk about something else besides my weight. And I'd say it's a coping mechanism too, but I want to bring it back on the table because that's the main thing. So how would I do that in a motivational interview? If let's say a patient walks in, they tell you, I know I'm overweight, I need to lose weight, but my real reason I'm here is because my back hurts.
Well, when we want to introduce a behavior change or a topic or target of change, which is really important in motivational interviewing, so you know what to listen for, it can really make a lot of sense to emphasize that the person you're speaking with has the autonomy in the conversation. So a really important tool would be just to ask permission. Would it be all right if we talked a little bit about your weight today in addition to the thing that brought you in?
And if I understand it correctly too, there's a point where if they don't want to go there, we don't go there. They're not ready. Is that true?
Oh, absolutely. I think that that is us as providers being empathic and conveying that there's an understanding here that perhaps right now it's not a topic of conversation. But I think that it is important as providers for us to be able to use reflective listening and also, plant seeds. So kind of implying that what we heard in a reflection is, well, it sounds like you don't really want to talk about this right now. Whatever brought you in here is actually more important. But in the future, you might actually consider bringing this back up again with me.
And also, I think I hear you saying is make sure you remove judgment and phrases that may imply judgment upon them. Is that true?
Yeah, that certainly, speaks to that collaborative, non-judgmental, relational component of motivational interviewing, because it becomes easier. And as a provider, maybe we become even more confident and more satisfied when we realize it's not our job to fix whatever is happening with the individual, but to just work with them in whatever their goals might be.
And then, but as you're drawing them along, so this person, there's a point where if I say, you know what, I'm open to talk about it a little bit, but I really, I've tried a lot of things. I've tried those crazy fads of exercise and proper eating, and it didn't work for me. That's a joke, but people who don't want to go there, how can you guide that conversation to, fulfill their goals?
Well, what we do know from the process literature, which is when people who are, great scientists take the time to listen and really intently to motivational interviewing conversations and understand what it is when the provider does something that a patient would respond, is that if we as providers don't ask for why it would be important to change, what are the desires of the individual, the reasons, the needs, and their abilities to consider or make a change, those things don't come out. People might not even think about them. So we will start to do those seeds. And
you're going to be drawing them out and say, as we go, your back hurts now. Can you think of a time when it didn't hurt? Yeah, and then you go back and what were you doing then differently? And what would it take to go back and do activities like that? Would that be motivational interviewing?
Well, there are certainly strategies to elicit what we would consider the technical piece of motivational interviewing, where we are deepening the individual's change language, their reasons and needs for change versus the why they don't want to change, their sustain talk. So looking back to a time when this wasn't an issue in their life, or looking forward to a time when this was no longer an issue in their life. Those are definitely wonderful strategies to help somebody get into a mindset of considering change, because change can be a little scary. And so if we are encouraging somebody to think about the positive things about change over the negative things about change without ignoring it, we see some success there.
So you're trying to draw out what their motivation is, what would make them feel good. My goal is to be able to walk long distances without huffing and puffing, or to pick up my grandkids, or to go for a bike ride. You're trying to coax those things out. What would motivate you to make a change?
Mm-hmm. Absolutely.
So what are some examples that are bad, things that doctors or practitioners or dietitians or nutritionists do that might be harmful to the patient?
Well, one thing that we think about sometimes is this idea of needing to, again, fix or share so much information, because we think that if we give the information, it's going to all of a sudden give the aha moment. So sometimes a shift in a mindset of a provider might be that I need to do something or say something to solve this for the individual. That mindset can actually lead to giving a lot of an information dump, right? So much, and the person kind of shuts down a little bit. Whereas if we can shift to more of that drawing out and eliciting and evoking ideas from the person, that can be a really positive way to move it forward.
So, for example, a dietitian might come in and say, we've weighed you. You weigh, 110 kilograms. We need to get you down to this other weight. Here's the diet plan for you. And if you do this every day, you'll expect to lose 2 pounds a week for, that kind of dump there. And really, you can't go on like this, because you're going to die of a heart attack by the time you're 55 years old if you don't make these changes. Things that just start the doors slamming on the patient. you want to avoid those type of conversations of just throwing things down. It sounds like your initial conversations, and you had a word, you had it for prolonging the conversation, to drawing the conversations out, and maybe over years, that they're not ready for change now, but one day they may come in and ready, and you need to be that trusted source of information. And what's some recommendations you would give to us about maintaining trust and certain things we wouldn't want to say to those patients?
Well, one of the great things about motivational interviewing consistently across behaviors is that when an individual, a provider, is trying to understand and conveys that understanding through reflections. It sounds like you are saying blank, or you are wanting this to happen. Those types of things really increase someone's engagement, and that will increase retention, which as providers gives us those tools, because the more we can see somebody, the more we can support their longer term behavior change. And so I think we are really working to moving away from being directive or prescribing without supporting somebody's autonomy. Just how about giving someone a menu of options? Because I think the individuals that are listening to this have wonderful clinical information and a lot of experience to draw from. And so as we're talking with our patients, a lot of times we can say, oh, wow, I bet option A, B, or C could be really useful for this individual. And so it's maybe just sharing it as there are some options that people might use. Which one of these might work for you, if any, and allowing the patient then to jump onto something and say that actually could work.
So big thing in motivational interview that I'm perceiving is you want to make sure you give them options, you listen to what they want, and maybe even bring them along to like where your goals can be aligned, that you can see if you took these steps, you could have how did you feel when you weighed 180 pounds? Well, I felt pretty good at this point. So what kind of things could you do when you were more slender? I could do these things. What would it take to get to that point? Are those examples of motivational interviewing?
Well, yes, those are a lot of wonderful questions, open questions to invite somebody to make statements of change. Right, their desires, their reasons, their abilities, and their needs for change. And in motivational interviewing, we're also looking at providers to use reflections. So it sounds a lot more conversational, maybe these statements back that, so you're looking for more options to get back to feeling better and stronger, or taking this, you would really like to see yourself playing outside with your grandchildren, running around the yard without this knee pain. And so when we are able to shift into more reflective statements, it makes the conversation a lot more, a conversation instead of an interview or an interaction where I'm somebody that's just constantly kind of asking.
So at what point can you say this person is not ready? What are some statements they would give you to tell you they're not ready for change and you really can't pursue it further other than to be a sounding board and be available for them?
That's a good question. I'm thinking back to some people that I've worked with that have said things to me like, I can't see myself doing it. Right? So what I'm hearing from them is low confidence to make a change, or, I don't want to do this right now. So their desire doesn't fall there. But I will say that as an MI provider, that never shuts a door for me. It just actually gives me more information about where I might explore further. Like if somebody has really low confidence, perhaps I want to talk to them a little bit more about, well, when's a time in your life that you did make a change? You got through a challenging issue and you were able to draw on your strengths. And having them talk about that and remind themselves about how that goes. Or if somebody is telling me that it's not very important to them to make the change now, asking them, okay, well, what kinds of changes for your health are important for you? Because sometimes it's not that you're getting a direct map to X marks the spot. Sometimes you're weaving it in a little bit and you're allowing that person to draw the map that fits right for them.
And a victory might be just change one behavior. What would you be willing to give up? Sweet tea, that fourth cup of sweet tea in the day. Maybe just get down to 3. So what about body language? Like you see doctors walk into the office, they look at their clock and they're busy on their clipboard or on the computer. What would be a better body language. What kind of empathy? How can you impart empathy through our body language and our tones?
Yeah. Well, it is a thought to think about how we like to be when we are patients, addressed, and what makes us feel comfortable. Now, it's not going to be the same for all of our patients, but we do know that when we make connections with people, it's because we show that we have time, we take breaths, we make eye contact, and we really invite the individual with the time and space to maybe think and respond to the conversation that we're having. And that can also mean honoring silence, because sometimes we're asking questions that people haven't thought about before. Why would you want to make a change for your health?
Well, it's sitting down, your tone, your tempo, like you repeat it back to them. Well, it sounds like you want this, so that it's not moving on to the checklist of questions that a practitioner frequently would ask. So this has been a great introduction to motivational interviewing. It's fascinating. So thank you so much, Dr. Hartlieb, for being here. Would you mind sharing your contact information with our audience?
Oh, absolutely. Individuals can reach me at Kathryn Hartlieb at parker.edu. And I look forward to hearing from you if you have any questions or comments.
Well, you've been listening to Dr. Kathryn Hartlieb, and this is Clinical Rounds.
Thanks for watching another episode of Parker Success Academy Clinical Rounds with Dr. William E. Morgan.